So now we're going to talk about passive immunizations. Generally, for passive immunizations, as well as some active immunizations, there are some adverse effects, which can include fever, rash, and soreness at the injection site. It can also lead to serum sickness, which includes like a fever over 103, edema in the face, cough, cyanosis, and vomiting. So those are just some things to look out for. Those are known adverse effects of some of these drugs. It's contraindicated in patients who have an allergy of eggs or yeast. Remember, that's something you're going to have to ask your patient about. Nursing implications include assessing your patient's allergies, if they have any type of immunosuppression, if they have an active infection, if they have chronic illness, if they are elderly, or if they are pregnant. And for all passive and pretty much active immunizations, you need to report unusual reactions to theirs at the CDC. There's like this whole thing that you can Google and you type in like what immunization they received and what batch it was and what was the specific adverse effects that your patient reported, just so that they can keep a tally of it, like, oh, this batch went bad. Why did this batch go wrong? They can figure that stuff out. You also need to give your patient any vaccine information, and they should also keep a record, because most like schools or jobs, or if they go on a mission trip internationally, they need to know their vaccine status. So there's 5 different categories. There are some things that we've previously talked about for active immunizations, but these can also be passive. So first drug we have over here is Hep B, and this is typically given post-exposure. So a possible accidental needle stick for a healthcare worker, or somebody's using a dirty needle, which would just be really bad. But there we go. Hep B, post-exposure. That's all you kind of really need to know about that. Immunoglobulin, this is going to increase antibody titer reaction potential. There's 5 different immunoglobulins that your body makes: G, A, M, E, and D. There you go. There's going to tell you what they do. This is not all the information you would need to know about immunoglobulins. These were the 5 different ones that your body makes. So I just listed them here. But if you receive an immunoglobulin, it's going to increase your antibody titer reaction potential. So just something you need to know. G crosses the placenta. Immunoglobulin A is found in secretion, so tears, breast milk, and saliva. M, or immunoglobulin M, is the primary response. Immunoglobulin E is for allergies, and immunoglobulin D is the B cell reaction thing. For Rhogam, this shot is given to pregnant women who are Rh negative and have they can't test the baby's blood before it's born to find out if it's Rh positive, Rh negative. But typically, if it's an Rh negative mom, they're going to be giving them a Rhogam shot to prevent the mom's body from attacking the Rh positive baby. So my sister-in-law has had 2 children. The first one over here, I don't know her blood type, but after the first one was born, when Lauren got pregnant with number 2, she had to receive these Rhogam shots because Lauren has Rh negative blood. And we didn't know if baby number 2 was going to have Rh positive or Rh negative. So what happens with this whole situation is that the mom's body, which is Rh negative, sees the baby inside thinking, oh, this could be, it doesn't happen all the time. It happens with the Rh positive babies, but they see this baby and they're like, oh, we need to attack it. It is a foreign thing. It's not the same blood. So the body sends fighters to kill the baby, to fight off the baby. So this shot, Rhogam, stops that from happening. It allows the pregnancy to continue on. And they have like a schedule of when the pregnant mothers are supposed to receive this shot. You don't need to know that, but you do need to know that this is suppressing the mother's antibody response so that she can continue on with the pregnancy. So since she had those Rhogam shots, she was able to successfully deliver baby number 2, which is my niece Molly. So Rhogam, pregnant women, it's when the mother is Rh negative, the fetus is Rh positive, and they don't want the mother to attack the baby, which is essentially what's happening. The next 2, rabies and tetanus, this is both going to be post-exposure. We did talk about these for active immunization, so people can get these prophylactically. So like not healthcare workers, animal workers or vets or animal healthcare workers could receive a tetanus or a rabies shot before, just beforehand, knowing, oh, I could possibly get bitten by a rabid animal, or I work a lot with rusty metals. I need to get a tetanus shot to help prevent tetanus in my body. These can also be given post-exposure because the body needs time to make antibodies. So rabies and tetanus can both be deadly, but taking these drugs post-exposure or prophylactically, which would be great, can help stop that deadly reaction. So that's what you need to know about passive immunizations. And there you go.